Hi, I'm Dr. Rasya Dixit from Dr. Dixit Clinic, Bangalore. I'm a dermatologist in private practice from the last 15 years. Infected hair follicles are also known as folliculitis or furunculosis. Folliculitis is they're both the same infection, basically the infection of the root of the hair follicle. Folliculitis is a little bit more superficial and furuncle is more deep, where the soft tissue also is inflamed. It is more bigger in nature. So folliculitis is more common because of Staphylococcus aureus. It is a common bacteria which is seen in the skin, and it is able to enter into the hair follicle either because of the humidity or because of the irritation of the skin, which could happen post shaving, post waxing, and sometimes even without any of these things. So once you get the folliculitis, the first thing we notice is a small pus point where the hair follicle was situated, and there's some redness around the hair follicle. Folliculitis usually comes in groups, so you may have a series or a common group of hair follicles which are infected at the same time, either on the scalp. It can happen on any hair bearing area, including face, chest, buttock, back, arms, shoulders. Wherever the hair follicles are present, you may notice the hair folliculitis. Usually it is very painful, it has got a sharp pain. When it is only one or two, it tends to resolve without treatment. If it is more in number, you may need to take oral antibiotics to get rid of it. What causes the folliculitis? Sometimes it might be a very close shave, or after immediately post waxing, the bacteria has entered into the skin and it is causing an infection. In case you have folliculitis and it is very painful, or if you think that you have diabetes or some other conditions which could make it very difficult to treat, please don't wait for it to get better on its own. Speak to a dermatologist immediately. But in case you have occasionally you got one or two folliculitis, don't worry about it. It is common because of heat or humidity, and it will settle down on its own. But if you have a lot recurrent folliculitis, please get evaluated for diabetes. Please make sure that you're changing your lifestyle, eating healthy, avoiding those things which may be causing the folliculitis to come back again and again. Avoiding waxing, especially in men, waxing on the chest and the back areas triggers large areas of folliculitis. Similarly, oiling the scalp extensively and not washing it often in a humid place may cause scalp folliculitis. So these have to be treated. The trigger has to be identified and treated properly so that you don't get a recurrence of this folliculitis. Because recurrent folliculitis can cause scarring, it can cause hair loss. So speak to your dermatologist to identify the condition and help you immediately.